Hello, everybody. Welcome to Along the Way. My guest today is Todd Houghton, and the subject is physical therapy. Todd, nice having you here today. Now, let's start. Please tell me some things about yourself, will you?
Sure, Russ. Well, thank you very much for having me today. I'm really excited to be here. I'm going to go way back.
Okay.
I was born in Providence, Rhode Island.
Yeah.
My mom's name is Suzanne, and my dad's was Harry Houghton. And I grew up in the town of North Attleboro, Massachusetts, right down the road.
Yeah.
And growing up, I went to Martin School for elementary school.
Okay.
And then I went to it's the middle school now, but it's the old community school in North Attleboro
Yes.
for 6th, 7th, and 8th grade.
Yeah.
And then I went to Bishop Ian High School, here, again, local in Attleboro, Massachusetts.
Yes.
And along the way, when I was going through high school, one of my great guidance counselors, Neil Lowe, asked me what I wanted to do with my life.
Yeah.
And two things that I knew. I love to work with people,
Yes.
and I love the sciences.
Right.
So at that point, he said, well, why don't you give physical therapy a try? So I went to Northeastern University,
Yeah.
and I received my bachelor's of physical therapy in 1994.
Yes.
And I've been working local in the Attleboro areas since then.
Yes.
I was married in 1997.
Yeah.
And I have 3 beautiful children,
Okay.
Paige, Olivia, and Jillian, and my wife's name is Amy.
Yeah.
And so I continued to work in the Attleboro areas. One of the things that my parents taught me was to try and stay local and to support local companies and to support the community.
Well, it's very important because we live in that kind of a community. This Attleboro area is just great in terms of the community. Now, you have, how many assistants do you have, Todd?
Well, presently right now, when I went off on my own in 2003, when I started my own business called Houghton Physical Therapy and Sports Conditioning,
Yes.
we've grown to where we have 28 employees right now.
Wow.
We have 9 physical therapists, we have 5 physical therapy assistants, and 3 technicians,
Yes.
and then some other wonderful administrative and supportive staff.
Well, that's pretty exciting. Now, I have to tell you that way back when you were with Dr. Guile, I had bursitis, and I was absolutely excruciating pain. And you worked that out, and so and through my life in various places, physical therapy has come in to help me, and I just know how terribly valuable it is. Now, let's talk about physical therapy. You deal with basically things with movement.
Yes, there's a lot of things we deal with physical therapy. For example, when you came to me for physical therapy for your shoulder, there's a few things we want to do first. The first thing is get someone out of pain. I know you were in a lot of pain.
Yes, I was.
And then because you're in a lot of pain, then you start to lose range of motion,
Yeah.
and then you lose strength.
Yeah.
So those are kind of the things we want to work on. So with you first, we worked on getting you pain-free, trying to get your motion a lot better, and then making you stronger, because
Right.
then you start to compensate, and then you can get other issues.
Right. And another thing, too, in preparing for this program today, it's the contact that you have with physical therapists. It goes beyond the therapy, actual movements that they take you through to restore whatever needs to be restored, but it's the relationships they set up with the client.
Exactly.
And I have found that your people are they're wonderful. They're so friendly, and that's important, to have this client-patient relationship. Because basically, and the other thing, you have to go through some steps as a physical therapist to, not in a sense, diagnose the problem.
Correct.
And then decide how to approach it.
Correct. On the first point that you talked about, one of the biggest things, I think the reason why I like to get into physical therapy is the social aspect of physical therapy. Because our biggest job within the first few minutes is to have the patient develop trust in us.
Right.
And that's to me is the biggest thing.
Yes.
So if the patient can trust us, then they're going to really buy into what we need them and what we want them to do to get them out of pain.
Right.
On the first point. The second point is the state of Massachusetts is a direct access state, which means that physical therapists can see patients before they go see their physicians. However, most insurance companies still want to have a physician referral.
Okay.
Now, with that said, I know that most people do come to us with a referral, but if they don't, physical therapists are trained especially in this day and age, that if we do an evaluation on somebody, we don't feel comfortable, then we immediately refer them out to their physician.
Okay.
Either way, even if we feel comfortable working on them and their insurance approves it, there's still a few things that we do. We do send the initial evaluation to the physician,
Right.
and we might even follow up with a phone call if we have any concerns.
Right. Well, that's wise to have that relationship with the physician.